Hi everybody. So do you think that pain means injury is my question for you today. I am Melissa Cady, the Challenge Doctor, and I am out here in the hill country in Austin. For those that aren't from Texas or been to Texas, there's actually quite a bit of hill country and definitely in the west part of Austin. So I just wanted to give you some ideas to think about because it really can shift your perspective on pain. And for example, most people think of, you break a bone, you're going to have acute pain. That's kind of a definitive thing. The thing that can be really confusing is when people don't realize things that kind of just come on, it seems like out of the blue, wake up with it. Sometimes we just assume that it's something really bad, especially when the pain seems pretty intense. But in most cases, especially if you think about back pain, most of the time it's not anything really to be concerned about as far as something life-threatening. Of course, you can always rule out those things through your primary care physician. But one thing I want to get across to you is an example, and hopefully I can do this with my hands here. Let's see. So if I took my finger, and I'm losing my camera, took my finger and I bent it back, and I held it back with my other hand. Let's see how we can do this today. All right. So if I held this back, we might have to try this with a different apparatus. Anyway, if I hold this back, if I hold it hard enough, most people would agree that this is a uncomfortable position. And after a while, you can actually maybe say it's painful. And I call this more of like a strain pain. So in essence, this pain is trying to tell us something. It's trying to say, hey, I don't like that. You might want to let go. I'd really prefer to have, my finger in a more neutral position. So that kind of pain is what I consider more of a strain pain. You won't find a definition probably out there anywhere like that. But that's just an example of sometimes your pain is just telling you that there's something not quite right. And when you're trying to interpret what's going on, sometimes we get very fearful and we think that there's something wrong or that we shouldn't move it if it's hurting. But sometimes that pain is saying that maybe you're not moving enough. So sometimes you have to explore your pain in a very gentle way and in either direction, depending on what it is. And I do that all the time. Of course, I don't get too worked up about pain. Obviously, I'm in the medical field, so I kind of have some interpretation of it. And I try to keep myself moving. And the reason why I don't stop moving is because there's a different kind of pain. And that is when you are deconditioned and you're not used to a certain range of motion, various things. And sometimes it's really hard to put your finger on it exactly why people have pain, but sometimes it's multiple contributors. So for me, I always like to remind people that just because you feel pain, it doesn't mean that it's life-threatening. And for instance, you just see my headband. If that's just a little bit too tight, just because my head starts hurting doesn't mean that I have a real serious problem. My body's trying to say, hey, dude, that's a little too tight. I'm probably not getting good circulation underneath there, or my nerves are a little irritated. So, maybe not wear such a tight headband. So, hey, John, good to see you. So that's just some examples of how sometimes when we have pain, it may not mean anything serious. So I know Jonathan is a huge fan of staying moving, and if anyone out there knows better than most about what it's like to have pain for long periods of time, Jonathan definitely has. So sometimes you just realize that you need to do things a little bit better in a different way. And sometimes that means moving, and sometimes it's not comfortable. So we talked about before pain of a workout. Some people actually are comfortable with discomfort, and some people are not. And I think people that started out, and this is my theory, is that if you start out in your life where you're used to doing sports or something where it's kind of expected that you push yourself and you see a benefit from pushing yourself, someone's clapping their hands for you because you're pushing yourself, there's much more of a positive association with the fact that you are pushing through discomfort. And it's kind of a disadvantage for those that aren't used to that for the first 2 or 3 decades of their life, if they don't have the inner drive, because sometimes you don't have that resilience to push through discomfort. So, those workouts is just another form of pain to a certain extent, but that workout pain doesn't mean that you're harming yourself. If you follow the rules of, go slowly, move in small increments. And if you don't do it, your body's going to remind you, and you might be hurting the next day, and it was probably too much. So I'm sure that Pete Moore will watch this video and say, yes, pacing is the way to go. So, you know, you got to be patient with your body. So all I wanted to remind you is that pain doesn't always mean injury. It can, and it's usually obvious, and there's a usual cause and effect. And if there's something you're really worried about, if your brain's fearing things, then just get checked out from a primary doctor. Make sure there's nothing that's a red flag or something that's concerning or life-threatening, and then get on with your life and try to find ways to explore it. And if you don't feel comfortable exploring your pain, then find a physical therapist or someone that's good with working with the body, and you can work on that journey together. And I'll tell you, just taking a pill for the pain doesn't necessarily help you explore it. In fact, it makes you less in touch with what's going on. So you really have to explore the pain, and it is work. If you really want to understand pain, it's a journey, and you have to put the work in it. So I encourage you to remember that pain is not an injury necessarily. And I usually say challenge your health before your health challenges you, but I'm going to say challenge your pain before your pain challenges you. Because if you don't try to explore it and understand it, even if you don't have a label for it, then sometimes you can find yourself in a worse place. So I hope you all have a wonderful weekend. I'm out from the hill country in Austin, and I'll see you next time. Take care.